Hi, I'm Jamie Duckers and I'm an adult cystic fibrosis consultant based in Cardiff. It's a really great time in cystic fibrosis. Life expectancy is increasing all the time due to a raft of new treatments, and there are lots of exciting prospects in cystic fibrosis care. So the actual landscape of CF care has changed dramatically. And that, ironically, is one of the problems that we're facing in caring for patients with cystic fibrosis. We're increasingly, as healthcare professionals, being asked by women with cystic fibrosis who are considering starting a family, and they're asking for up-to-date and the best information that they can get. Obviously, we do look after patients that have had babies and started families with cystic fibrosis, but a lot of the evidence that we base our advice on is actually quite old and in relatively small numbers of patients with cystic fibrosis. We're in a really fortunate position that we've just been awarded a research grant by Welsh Government, so it's a Research for Patient and Public Benefit grant, and we would like to try and provide much more up-to-date, much more detailed information for women and their families when they're considering, is it now the right time to get pregnant? So what we've done is we've designed this research project. The first part of the project is to really get a good evidence base. And so what we're going to use is the UK registry data on cystic fibrosis and the US registry data. And so this is an anonymous database covering thousands of women with cystic fibrosis. And obviously we're going to interrogate that database and look for women who have become pregnant and what's happened during their pregnancy, what's been the outcome of their pregnancy, and then subsequently how the mothers have done having delivered their babies. The second part of our project is then using this information and finding out what women with CF want to know about the data and also what healthcare professionals would like to know, and then we tend to use that survey data and questionnaires and interview data from those patients and healthcare professionals to then start to design a bespoke decision-making tool. And we hope that this decision-making tool will really be based on good evidence, and it will provide the information that women want to know, and it will help them feel empowered to make a more informed decision. Obviously, our ultimate aim is to be able to provide this decision-making tool free of charge to all women with cystic fibrosis and their healthcare teams.